article was on the Lee-Silverman voice treatment, or Lsvt. The population that benefited from it were Parkinson's disease patients, but there have been benefits in other populations as well, for example, children with Down syndrome or cerebral palsy. And it's interesting to me because it has such simple tasks, yet huge outcomes for the patient, so the simplicity really attracted me. The hypothesis my article investigated was assessing the effects of improved vocal function and loudness and voice inflection 2 years post-treatment in Parkinson's patients using Lsvt. It was compared to the received respiratory therapy, or RET, to make conclusions. The study included 33 patients from Denver, Colorado, with idiopathic Parkinson's disease and no other laryngeal pathology. The groups and SLPs were randomly assigned, and there were 17 men and 4 women in the Lsvt group and 7 men, 5 women in the RET group. The 2 variables studied were loudness, measured in SPL, and fundamental frequency, measured in STSD. Assessment and vocal function were carried out in 3 tasks: sustaining an ah, reading the rainbow passage, and monologue. Lsvt focused on sets of tasks, improving phonation and respiration. In Lsvt, the patient was instructed to produce with their loud voice during tasks. Monitoring loudness and encouraging extreme effort are important for Parkinson's disease patients because they usually have impairments in sensory motor processing, regulating internal movement cues, and other executive function tasks. RET was based on respiratory drive alone, targeting inspiratory and expiratory muscle activity. Comparison was used to rule out extraneous factors, and encouragement to think loud, be loud, and just breathe indirectly stimulated the respiratory system. Both treatments were intensive, with 4 one-hour sessions a week for 4 weeks. They concluded Lsvt showing greater improvements in quality, prosody, articulation, intelligibility, and swallowing. Lsvt improved in all 3 tasks for SPL and STSD, and RET did not. It showed 1 increase in the SPL of the rainbow passage, but it was not significant. Beyond just a loud voice, they found increased motor drive and self-monitoring skills, as well as improved communication and quality of life. The strengths include being the first study to look at the effects 2 years after treatment, adding credibility and reliability to the treatment, and training the SLPs in both of the treatments to eliminate any huge differences in giving the treatment to the patients. But they didn't assess patients with any other pathology, so this is a limitation, I think, because these results cannot be generalized to patients with multiple problems. The study gave 3 explanations for how and why Lsvt works. 1, patients learned to improve vocal fold adduction. 2, patients overcame higher level deficits such as memory and programming. And 3, higher effort levels stimulated the limbic system associated with drives and goals. I would be interested in researching more with what the OT and PT do in Lsvt Big.